Okay, excellent. It is, I don't even know what day it is. It is Wednesday, July 23rd. I'm Dr. Richard Kim, and this is, and I lost it. Let me see if I can get this back here. This is okay. Here we go. Once again, sorry about that. I'm Dr. Richard Kim, and this is our July 23rd webinar with regards to regenerative medicine. And for those of you who are at home, number one, turn your volumes up if you haven't done so already. And number two, there's a little button at the bottom that'll allow you to hit the Q&A, and that'll allow you to ask some questions. Certainly ask questions throughout, but I'm going to wait till the end to answer all the questions together. So exactly what we're here to talk about is how stem cells solve pain. So here's a couple of Q&As to begin with. Elaine B from area code 450 said, I'd like to know how to deal with my back pain, info on your stem cell treatment. And for us, obviously, the answer is regenerative medicine. But what we plan to go over today is a little bit going into, well, what is it and who exactly does it help? Kim G from area code 518 had some pretty similar questions. How does the process work? My mother has stenosis and does not want surgery. The odds of success. So, obviously we feel quite strongly, and this is largely due to our experience with regenerative medicine. We really feel it's the best alternative to surgery. And throughout this webinar, we hope to instruct you on that as well. Adrian from area code 315 asked what is involved, and we'll go through that during the webinar and webinar and future consultations. Roger M from 917 says asked for an introduction to stem cell therapy, so the answer is the same there. We all pretty much have some pretty common goals. We all want to relieve pain, but we always want to do it in a way that can, have some certain goals with it. Number one being, can we do it in a way that avoids surgery? Number two, can we do it where we want to avoid, long-term medications? And number three, we all want something that'll improve the quality of our lives. The common goals, we want a few things ensured. We want a plan. We want something that is going to have a beginning and end. And number two, we want that plan to be safe. We want it to have low risk. We want it to have short recovery and avoid pitfalls. And I'd say that in asking for all the things in a perfect world, this would be it. Here's a couple of examples for you. Number one, this is a retired psychologist who flew airplanes for a hobby, is a runner, and did it for competitive reasons, but also for stress relief. But the back pain ended his running. It meant no more competition. That means the fun of it, the stress relief that he got from running was going to go away. And the back pain also limited his flying time. We have a second example of a chef who enjoyed spending time with his family, but that meant constant motion. That meant moving heavy restaurant equipment, which was ultimately difficult. The back pain was affecting his work, affecting his day to day, and then he ultimately was contemplating changing careers. The problems with current therapy is that they miss the target. Traditional treatments are limited, and they're limited because number one, surgery is often permanent, it's invasive, requires long recoveries. Medications, steroids are typically a band-aid. They weaken, they damage tissue. Repeat steroids mean just further repeat weakening and repeat damage. And over-the-counter medications, they certainly lessen symptoms, but the effects wear off, and you have to then repeat the dose. 2 months after stem cell therapy, our psychologist was returning to running, ran the 4th of July race here in town for us. That was a 4 mile race, ran a 13-minute pace, so wasn't his fastest, but happy to run it. Gave him enough confidence to train for a half marathon with his grandson, and ultimately this was his goal. The chef was able to go back to work full time and provide for his family. So both, very important and very positive outcomes. But exactly what do we do? What we really do is break the cycle. So when you have pain, it leads to degeneration, and when you have degeneration, it leads to more pain, and on goes this cycle. But what we are is really the third solution, not surgery, not medications. It's us. So with us, we have a high success rate. We've got something that will offer you years of relief rather than this, every month, every 2 month, every 3 month, injection after injection idea. And with what we do, it's guaranteed acceptance. It's cells that come from your own body back into you. So some obvious advantages there. What exactly is regenerative medicine? It's a new field of medicine. And so, for those of you who have not heard about it and wondering what it is, it's because it's new. And the real goal here, and this is important, is to restore the tissue in that area and not to replace it, which is, typical of surgeries. We want to take damaged tissue and turn them into healthy, functional tissue. We take different materials throughout our body, and we use them to restore this health, including platelets, also known as platelet-rich plasma, and stem cells. PRP, how do we differentiate when to use stem cells and when to use PRP? So PRP is great for the green and the yellow circles, and we'll call that small and small medium problems. And then stem cells are really more reserved for the medium to large size problems, right? So the more significant arthritic conditions, the more significant degenerative disc diseases. Here's a good video example of what it's like when stem cells enter an area. They are simply attacking the area that's bad. So if red is bad and green is good, and the red is, what we experience as people, as pain or stiffness, sciatica, nerve issues, shooting, aching, grabbing type pains and discomforts. I like the Pac-Man analogy here. If you can imagine Pac-Man on the screen, pellets are the inflammation. One Pac-Man eating one pellet at a time, that's similar to platelet-rich plasma. And then therefore many Pac-Man eating many pellets at one time, that's similar to stem cells. The goal here, though, is to not just get to the next level, but it's to beat and leave the game entirely, and leave the problem behind. And we're talking about, depending on what we're treating, something that can last anywhere from 5 to 10 years. Where exactly do the stem cells come from? So this is a great example. We take it from the bone and bone marrow. We remove it, we extract it, we process it, and then we'll re-inject it back into affected areas. Picture on the right is a good example of that in a degenerating disc. So for us, a lot of our timeline and scheduling for stem cells looks like this. Initial step is obviously have a consultation with us. Somewhere along that line, somewhere after that and along the line, we're going to get an MRI. Then we'll perform the first platelet-rich plasma or the first injection. And then usually about 2 weeks afterwards is the second injection, and that's where stem cells come into play. About 4 weeks later, the third injection. And once we do that, physical therapy, chiropractic care, exercise is going to be the rebuilding portion of strength. So what exactly do we treat? So when it comes to the neck and back, if you've heard these words before talked about for you and your neck or your back, this is going to apply to you. So stenosis, arthritis, degenerative disc disease, sciatica. For those with lower body issues, arthritis, bursitis, meniscus damage or meniscus tears, Achilles tendon damage. What about in the upper body? Rotator cuff tear, damage, tendinopathy. I know somebody asked us about arthritis, tennis elbow, carpal tunnel. These are all the sorts of things we can treat. So then you want to know, am I a candidate? Well, the way we really like to describe uh, candidacy is basically if we can inject it, if I can put a needle to that area, or if somebody can operate on that area, I can also place stem cells in that area. And that's a pretty key portion. The stem cells work in the area that they are injected. The very first step, though, that's important for us is that we have to have a diagnosis. So you can imagine if we can have an accurate diagnosis, then we can accurately locate where your pain is coming from, which also means we can get a needle or perform the therapy to the accurate location. All of our therapies always include an MRI, unless you're not able to get one, obviously, but an MRI that is in our own office, and that's always inclusive. But what if you've had surgery? And the answer is yes, you can still have stem cells, but it depends. And so, which is why a consultation is important. Diagnosis, if you have it, imaging, if you have it. But for us, certainly a history, taking the history from you, getting to know you, getting to know where your pain is coming from, examining that source of pain is going to be important. The type of surgery is also important, whether you've had arthroscopy, a fusion surgery, rotator cuff surgery, all these details are very important for us. So make sure you come with at least the dates and surgeon and type of procedure. So let's start going into some frequently asked questions. Where will my stem cells come from? So for us, stem cells primarily come from two major sources. Number one, from fat, so similar to basic liposuction, and that would be one source. And then second is from bone marrow, and then that comes from, like we were showing you before, the pelvis, the rotating pelvis. So it comes directly from bone. But 100% always from you. So that's important. How long before I can become active? So, according to our timeline, once we get to that third injection, from there on, all activities resume. We want you to be cautious. We want you to be, mindful about not overdoing it. But if you wanted to golf, if you wanted to jog or run or go to the gym, that's essentially when we would start it all. When would you feel the benefits? So the benefits all start. Um, Anywhere from the about the time of the third injection to as far as 8 to 12 weeks out. Some people even further still, but I would generally say within the first 12 weeks, that's the majority of times we've seen people feel improvement. How long will the tissue stay repaired? Great question on this one. So it's typically, like I said, anywhere from 5 to 10 years. An important follow-up to that is that a lot of these therapies are repeatable. So for maybe the first time in maybe, medical history, we're talking about avoiding either a spine surgery or avoiding a knee replacement, for the rest of your life. And then, of course, we all want to know how well does this work? So it's very important that, that during that consultation, we get to know you, we get to know what you're looking to do, and we can get a sense of how well this is going to work for you, depending on the severity of your issues, the severity of your pain, your functional capacity. So very much individualized, but something we definitely address during every consultation. So we'll get into the questions here. So for the first Q&A, Debbie K from 4015 says, how this can help spine disease. So for us, when we talk about spine disease, we're talking about a bunch of different named diagnoses. So degenerative disc disease is one. Herniation is another, stenosis is another. And some of these are sometimes related, sometimes these are independent. So for us, in talking to you, Debbie, knowing which of these spine diseases you have, we can talk to you a little bit more directly about how exactly this is going to help you. So in the case of, let's just say, degenerative disc disease, how exactly does this help? So to understand degenerative disc disease is to understand the jelly in the donut. So if we said that your disc was a jelly donut, when the jelly leaves the donut, that's what either herniation or a slow loss of jelly is degenerative disc. What we're doing is by placing stem cells within this jelly donut or disc, we're helping the integrity of the donut. And that ultimately means that you are improving the quality of that donut or disc, which means that you're improving the quality of your spine function and mobility, which ultimately translates into improved quality of life. So that's the way we really see that and look at that. Richard C. from area code 925 simply said back pain. So regenerative medicine, well suited for back pain. And when we talk about sometimes cortisone and steroids, they wear off, they have side effects. And surgery, unfortunately, has permanence. Sometimes some of the things we were talking about before. And for what we do, this is really a minimally invasive therapy. It's done right here in our office. No general anesthesia is required. So some clear advantages. Sandra K from 413 said, I have had in my lower back L4 and L5 for years. I have been to chiropractors and I've had injections as well. Love to be pain free. So it sounds like for you, Sandra K, you have multi-level degenerative disc disease. So you've got this difficulty or this pain or this degenerating disc at several levels. Obviously, with what we do, it's something that we can apply to multiple discs, except we can also do this to multiple discs at the same time. So rather than, for example, surgeries going for one or two levels and then having to go back for more, we're able to treat multiple discs all on the same occasion. Again, improving the disc quality improves your spine function, improving quality of life. James C. from area code 410 said, is regenerative therapy appropriate for lumbar canal and foraminal stenosis? And I'm going to say that it is pretty ideal for stenosis. Again, we're improving the disc quality and function, and that really helps remove some of that jelly or some of that pressure off of the canal, and that canal is occupied by the nerve. And so if you can remove that occupation, you can improve your spine function. Ultimately, the word stenosis means pinch. If you find the pinch and you can release the pinch, you can improve the canal and foraminal stenosis. And regenerative medicine and stem cell therapy does this quite well. Diane M. From 518 said, interested in how this works and its benefits are better than surgery. So absolutely, we certainly think so. And some of the benefits are listed here. It's minimally invasive. It's in office, local anesthesia. We use oral sedation only. Oral sedation and local anesthetic. It's a quicker process, much shorter recovery than surgery, done with injections only. No permanence like surgery, and we certainly have seen that the results are better than surgery can be. Maureen from 518 says stem cell progress for lower back pain, arthritis, calcification. Have you heard anything about stem cell and Parkinson's? So pretty straightforward. Back pain, arthritis. That's exactly what we do. The answer is yes, we can help that. Number two, Parkinson's. No, we don't do it for that. There may be some growing evidence for stem cell therapy out there. We unfortunately don't do it for that, and not really in the know with Parkinson's. With regards to calcifications, I'm going to say yes, but it depends. Where is the calcification? Certainly, if you have imaging that can help us, that would certainly be helpful. Michael B. from area code 315. My sister has numbness and tingling down both legs and in her feet, probably caused from stenosis in her back and arthritis. They have never once said like a pinched nerve, but something is pressing somewhere, and then she just has pain lower back lumbar pain from the fusion. And she wishes she could get rid of the numbness and tingling more than anything. Okay, so you can see in the background what a picture of a fusion surgery looks like. When you have a fusion, you are at risk for something called adjacent segmental disease. So, what I like to describe is the bike chain. If you have several links of a bike chain and you fuse two links together that no longer bend when they're supposed to bend, now the chain links on either end, the one before and the one immediately after, now have to be more flexible for the one that got fused. That increased flexibility now is at risk for something called adjacent segmental disease. So, in the case of your sister, I'd be interested to understand whether the nerve pain was there before, nerve pain there afterwards. Is this nerve difficulty she's having temporary or is it permanent? So certainly for someone like her, an in-depth consultation with myself is important. Raymond from 518 said, I've had a laminectomy, fusion of L3 and L4, have done extensive water therapy, PT, half a dozen steroid shots. I still suffer from pain and can only walk a few steps. My balance is slowly getting worse. So again, adjacent segmental disease would apply to you as well. I'm wondering for somebody like you who says these sort of key words, if you're suffering from this. With regards to the balance, that's a combination. Balance is a combination of both nerve function and muscles. So, are you having nerve issues from the spine, or are you developing weakness because of pain? And you can certainly understand that distinction is important. What I typically tell people is that we can inject people for pain, but we can't inject them for strength or for balance. That you have to build on your own. But if I can eliminate the pain, then your ability to gain strength, your ability to gain balance is improved. So really have to remove that barrier of pain before we think about developing strength and balance. Elaine B from 450 said, I have lower back problems caused by two accidents. First accident in 73, hit by a car, lower back. Told all was okay, one vertebrae out of place. Due to low back problems, activated by fall on the stairs in 2010. Down the stairs on my back. Now have arthrosis in the left ankle due to that fall. Also, I'm 81 going on 82. Congratulations. Walk with one or two cans at times for balance and support. So this is a perfect example of what we call epicenter and collateral damage. So sometimes patients will have one problem, and even though there's that one problem, and it may be stable, but over time it progresses. We're talking about then developing collateral damage, and then those collateral damages can become epicenters of their own. So for somebody like Elaine here, not only is there a back pain, but there's an ankle issue that's either developing or exacerbated by all of this. So for us, we really want to address all of these things, and we do them in a stepwise manner to make sure that you can get back to the highest quality of life possible. So for you, again, consultation is the next step, and really helping to make that diagnosis, especially with the two accidents involved. Kevin from 518 said, can stem cells help chronic back and neck pain? Since first injury, my neck, June of 2000, and back December of 2000, I have been, I'm going to get steroid injections, and they seem to have stopped working. I also have chronic bilateral shoulder and knee pain that's worsening, and steroid injections are getting less effective. One knee has been in need of a knee replacement surgery for about 4 years. So I'm going to say back and neck, yeah, absolutely yes. This is what we're good at. I'll say with regards to the neck stem cells in particular, this is what we're particularly unique at. As far as I know, we're the only known practice east of Colorado that does stem cells to the disc of the neck. It's a very particular skill, but our results with it have been excellent. And so certainly if this is something that sounds like it could be helpful for you, certainly give us a call. But shoulder, knees, quite common, very successful areas. And there's, unfortunately, an effect from the steroids that, is tolerant and progressively less benefit. And ultimately, they are just a band-aid. And so it's not surprising that you did steroids and now they're not doing so much. Raymond from 518 said, will the procedure help me? I've had a laminectomy fusion of L3 and L4, PT, steroid injections. Dean R from 518 says, treatment of arthritis at L405 after fusion in L5S1 11 years ago. 1 month old MRI, pain in the right buttocks, SI joint, nerve issues down the right leg, difficulty standing and walking. So for both Raymond and Dean, this is a good time to talk about a diagnosis of failed back syndrome. So you've had back pain, you've gone through the surgery, and yet you continue to have pain either immediately after the surgery or sometime after the surgery. And adjacent segmental disease is something we talked about before, is something that can contribute to this. And so for a lot of people, and with good reason, they're not particularly eager to go have more surgeries. And, the studies have shown progressive surgeries in situations like this are less and less effective. But for us, stem cell therapy fits in really, really well for patients like you, Ray, and Dean. It's that because we can address the disc without ever creating further episodes of adjacent segmental disease, which is what you would happen if you simply just fused again. So pretty ideal candidates in both of you. I'd certainly recommend coming in for consultations. Dr. Patricia R. from 713 said, would like to learn more about Dr. Kim's stem cell practice. Our daughter Elizabeth just had some work done on her spine by Dr. Kim, and she is doing well. Good. I am age 77 and being encouraged to have both knees replaced. I'm very interested in Dr. Kim's treatment for knees. I am often sore walking now and taking stairs one at a time using a railing. So again, we were talking a little bit about nerve function and balance and muscular strength and how that's something that needs to be built, but need to really eliminate the pain first. So for us, spine and knees are very frequently treated areas. During this consultation, we're going to be asking you some key questions here. Number one, what's your function like? Number two, tell us the history of this knee pain. What have you done? What have you not done? What have you tried? What haven't you tried? And if you have any imaging, that's always helpful, but don't let that be a barrier. Since we have our own MRI, we're able to get that sort of imaging for you. Kirk from 680 said, if this therapy will work for my lower back issues. And so for back issues, again, are we talking degenerative disc? Are we talking stenosis? Are we talking arthritis? Which of these issues is it? And not only which of these issues is it, but what is the severity? Obviously, we'd like to get that additional information from you. And that will all take place during consultation. Thomas T from 315 said bone on bone knee arthritis. And unfortunately, we feel like bone on bone is a phrase that is often overused. I think it gets used in the orthopedic community often. And when the patient shows up with x-rays, they're in fact not bone on bone, but there's cartilage, but maybe thinning of cartilage. And it's important to recognize that it's not the image that's important, it's the patient's function that's important. So we've seen people with quote unquote true bone on bone arthritis in the knee, but no pain. And conversely, people who have a little bit of arthritis in the knee and in tons of pain. So it's important that as whoever you're seeing, whether it's me or somebody else, that they really pay attention to you and they're treating you, the patient, and not the picture. For us, we like to, during the consultation, review that function, go over any imaging you have, and sort of isolate down to you and what makes it unique for you. Jerry K from 516 said, two lower disc problems, also right kneecap problems. So disc and knees, yes, absolutely, very frequent things we treat. But there's an interesting about discs and knees is that they have very similar issues in that they have very poor blood supply. So it's kind of like this dilapidated building I have in the background here. If you built a building in the woods and no road to get to it, the building just continues to fall apart. If you built a road to it, then you could deliver materials. You could take ladders and trucks and whatever it is that you need to rebuild that material or rebuild that building back up. Regenerative medicine and stem cell therapy is rebuilding that road. And once you get that road rebuilt or you get that blood supply reinvigorated or reincorporated, then you can take all of these healing factors that normally live in your body to then go and heal that building, to go repair and fix that knee or that disc. So obviously for us, very confident we can help both. Consultation, and again, if you're thinking about the concerns about imaging, don't worry about it. Come on in and let us see for ourselves how your what shape your building is in. Paul from 449 says one issue due to our osteoarthritis, very active, and this has been negative, affecting overall well-being. Um, so the other sort of analogy I like to use when it comes to buildings is if you went into a room, started punching holes in the wall, then you have holes and debris. Debris is all over the floor. What stem cells are really good at is, again, not only creating the road there, but it's also good at clearing the debris. It is not going to patch that hole per se, but the stem cells themselves will help clear the debris, allowing for you to walk across the room and get from one side of the room to the other with relative ease. And again, for our osteoarthritis, especially of the knees, we're talking about therapy that lasts anywhere from 5 to 7 years. Sandra S. from 315 said, wondering about plasma treatment for knee pain. We talked about this in the green, yellow, and red circle, small to small, medium-sized problems, great for plasma. So the severity is important. If you know your severity, great. If not, then we can help you certainly figure that out. But the other thing too is when you say knee pain, are we talking joint? Are we talking tendon? Are we talking some other portion of the knee? Stephen from 315 said lower back pain, been diagnosed with spinal stenosis. So again, stenosis is basically a tunnel, and it's about the different contributing factors that are creating a narrowed tunnel. Sometimes it's disc, sometimes it's ligaments, sometimes it's tendons and muscles, and sometimes it's all of it. Through our process, we really are treating what we call the functional unit. So we treat not only the disc, but the ligament, the tendons. And we've recognized that when you treat all of these various parts of what's contributing to stenosis, you have better success. Not that much of a surprise. So yes, to stenosis, something we treat often, consultation key. Oops. Anita said from 607, what are the costs, the efficacy, risks of stem cell therapy for spinal stenosis, osteoarthritis, and previous compression fracture pain, and subsequent physical limitations? For us, what's important here is that this is a very individualized therapy. So from one person to another, what one person needs and another person needs is quite different. Because of that, Um, very difficult to assess the cost. Car sound and mechanic is my other analogy here. It's like you calling your mechanic and saying, my car's making a sound. How much is that going to cost to repair until you bring it into the shop and let us have a look? It's almost impossible to say. So this is why the consultation is as important as it is. Mary Lou W. from 518 and Linda P. ask very similar questions there, and Linda's from 518. Mary Lou asks, is this covered by Medicare? If not, how much does it cost? My husband's knees are horrible and no longer getting a lot of relief from steroid shots. He's 82, hates to think about getting a total knee replacement. I can understand. Does his age exclude him from stem cell? His back is a mess too. Does one systemic treatment address both his knees and his back? Linda P. Said help with low back and knee pain. So very similar in both. So getting steroid shots, and again, we talked about steroid tolerance going down or steroid tolerance going up and relief going down. So in that sort of scenario, we typically talk about steroids helping 3 months, then 3 weeks, and then 3 days. So less and less effective. Age certainly does not exclude them. Our oldest stem cell patient was in their 90s and they did well, got their driver's license back, went on to, live a great quality of life. Medicare, unfortunately, does not cover. When it comes to knees and backs, we do treat them separately. The cells really only work where they're placed. So if you're treating a knee, have to put the stem cell in the knee, can't put it near the knee, some other part of the body, and expect the stem cells to make its way to the knee, really have to be directed. Rebecca from 315 said interested in information about stem cell therapy for my mother. So regenerative medicine, some quick basics here. It's great instead of pain medicine, great instead of surgery. Therapy that can last years. So really help with your mom's quality of life. Here at Richard King Medicine, we've had thousands of people treated. I've been doing this for 11 years. And one of the important distinctions is this is all we do. I'm not also a surgeon, or I'm not also a primary care doc, or also a sports medicine physician. This is it. This is what we do. And I'm going to say we're pretty good at it. Raymond from 518 says process pain level results to expect side effects, areas of the body where this can be used, efficiency, durability, timeline, people who have used the process, pricing. So it really depends. Again, what are we treating? Are we treating your low back? Are we treating your hip? For you, Raymond, that's all going to matter. Non-invasive therapy, we're utilizing cells that come from you and your own body. I really like to think about this as a cellular transplant. I'm really taking, excellent repairing, restoring cells from one part of your body and putting them in bad areas, your knees, your back, your hip, where there is damage, and then restoring the function of those areas. Paula C from 518 says, I have bilateral osteoarthritis in both knees. Told I need a knee replacement. I want to avoid that. Can stem cell therapy help? So the answer is yes. This is what our very first stem cell therapy ever was for. And the person went on to do well, got years of relief. So for those in pain, and instead of a knee replacement, and this is for everything in between. So to explain that sentence a little better, if you're in pain, but you're not yet in need of a knee replacement, or you are in need of a replacement, for everybody in between, these kinds of therapies can be helpful. So consider the gap of having steroids and then having nothing else until you're quote unquote bad enough to then need knee replacement. Stem cell therapy, regenerative medicine therapy fits in that slot very well. Regenerative medicine, we're minimally invasive. We're all about restoring function. We're all about restoring mobility and, of course, eliminating pain. Ed L from 315, hip joint repair is a non-inflammatory red wine okay during the procedure? Can anything be done to make this procedure last more than 5 to 7 years? If need be, can this procedure be repeated? If this procedure guaranteed? After recovery are sports like martial arts, mountain biking, hiking, cross-country skiing okay? What activity is not good after this procedure? So with regards to hip stem cell counseling, no to the red wine. A yearly platelet-rich plasma is incredibly valuable. Yes, it's repeatable. And I'm going to say any sport is within reason. Unlike metal and plastic, which may break or fall out of place, this is still your own hip. So if you want to do martial arts, if you want to do cross-country skiing, we are okay with that. And had many people go back to do those types of activities. Johnny from 514 says, I have stenosis in my low back and they refuse to do surgery. Unfortunate. It is dangerous. Can you do something? I'm in Montreal. So yes, for people with stenosis, and again, not all spine problems can have surgery. But for somebody like you who has stenosis and for whatever reason they've refused surgery, this is something we can help. And remember, stenosis is just about a wire and a tube and basically crowding around the wire. And you can see the pretty close relationship here between the blue of the disc and the red of the spinal cord. If you have crowding from a degenerating disc, that will make your stenosis either develop or get worse. But being able to treat the disc and making that stenosis better would be the entire goal of regenerative medicine. So ultimately, improve the disc quality, improve the spine, improve the stenosis, and then improve your quality of life. Joyce from 518 said, I had a consult with you regarding my knees in October of 20, diagnosed with arthritis and bone on bone in both knees in 2018, had physical therapy, injection, and do exercises. Think my next step is stem cell therapy. What do you charge for two knees? Senior discounts available. I am 70. Joyce, thanks for reaching back out to us. You'd highly recommend a consultation. So if it's been now ongoing 5 years, we want to see what's changed, if anything has changed. And certainly for those who do schedule both knees all at the same time, there is a discount. But certainly we're going to need to see you and meet you before being able to offer that. Anthony from 315 says, addressing arthritis and spine and degenerative disc. So very similar to the last picture, we pulled up the disc relationship to the spinal cord, which is in red, and then the yellow portion is nerve. So you can see it's a very, very close relationship. And then at any point in time, when the disc degenerates, when the disc herniates, those nerves, that spinal cord can get affected pretty quickly. But again, improve the disc, improve the spine, improve your quality of life. Sally from 518 says, is an alternative to hip replacement surgery? Absolutely. For those who have hip arthritis, you've got a loss of cartilage. But not only are you having a loss of cartilage in the joint, but for a lot of people, they develop bony edema or swelling throughout the bone. And certainly treating all of this at the same time is going to be important. The next important thing is, of course, when you do undergo these types of therapies, we're talking about something that lasts 5 to 7 years. Consultation is being key here. We want to see your severity, what your physical limitations are. Marianne from 518 says, how long does pain relief last when the mid back is treated due to a compression fracture in 2014? So great. So compression fractures is where the vertebral body, the bony portion of your spine, basically collapses. But that really disrupts the end plate, and the end plate, circled there in red, is important. The disc receives nutrition. The disc receives healing factors from the bone through the end plate into the disc. So when you've disrupted that with trauma, you're essentially promoting degenerative disc because once that disc sees trauma or injury, it's going to be very, very difficult to heal because the pathway for nutrition is eliminated. What stem cells can really help with is recreating that connection to regain nutrition, to regain some of those healing factors. So much so, in fact, that we're seeing people who undergo these therapies get relief for 7 to 10 years. And that's obviously quite a long while. Greg P said from 315 success rate, will this therapy work for other joints, knees, hips, toes, etc.? So again, being this the only thing that we do, we see this from everything from the toes on up to the neck. But success really depends on who we're treating, where we're treating, is this joint, is this tendon, is this ligament? So if you can help fill in some of those blanks with a consultation during a consultation, we'd have a lot more information for you. Tanya from 585 says, do you have any treatments for CP in left hand? My 19-year-old son is struggling. So the question would be, are we doing this for CP or are we doing this for musculoskeletal reasons? If you're simply doing it for cerebral palsy, likely not. If there's a musculoskeletal component, for example, they've developed tendonitis, they've developed arthritis, then the possibility does exist. But obviously, we'd have to meet. And during that meet, we want further details. When exactly does it hurt? What imaging have you done? And we can sleuth all of that out during a consultation. Ralph from 315 said spinal stenosis. I've had shots, laminectomy, several other procedures done on my back. After the laminectomy, I produced a cyst on my spine and have been told that I would have to manage pain the rest of my life. Interested to hear from patients who have been helped by this procedure. So it sounds like you may be having and experiencing some post-surgical pain. Again, failed back syndrome. You do have a cyst. Want to know where? We'll need a lot more details about it. Consultation is key, and we can certainly connect you with people who have undergone this therapy, may not have one exactly like yours, who's developed a cyst after laminectomy. So some of that may be, not fitting exactly, but we'll find you certainly somebody who is close. Nancy from 315 says, could this treatment help with herniated disc and or foraminal stenosis? And you guys get it, right? We're getting a lot of the same questions because a lot of people suffer from this very similar things. So again, herniated disc idea being it's a very sudden versus the slow jelly leak of degenerative disc. And then that then contributes. So if you have a tube or a pipe where the nerve lives, and you can then develop some stenosis from degenerative disc. But anytime you have a herniation, you're pushing into that space even further and then worsening your stenosis. So that's how disc and stenosis are related. Therefore, if you treat one, you're treating the other. Michael W. from 585 says, can stem cell therapy help my severe lumbar spinal stenosis? Again, treating functional units of the spine. So in somebody with severe lumbar stenosis might need to do more than just the disc, might need to treat the ligaments, the tendons, the muscles. With our process is designed, it's coordinated, it's intended to treat all of these different areas. Magnata from 610 said, I have lumbar arthritis and facet and stenosis issues here. I get spasms. So again, talking about disc nutrition from the bone through the end plate to the disc. Arthritis basically means that that disc is degenerating because it's no longer obtaining nutrition. But to treat the disc, amongst the other areas, ligaments, muscles, tendons, is going to be key. Deb W from 315, if info on symptoms of spine problems that affect lower back painful and possible leg spasms, if both could be possibly connected, and what is available to remedy or offer healing? Back and leg involvement, certainly the two are connected. When you're having issues in the spine and the nerve that then connects down to that leg are all on the same chain, if you will. Injury at the back that affects the nerve, ultimately downstream. And what we'd want to know from you, though, is do they happen together or do they happen separately? Because it is also possible to have that be two separate problems. Therefore, we're going to want to know, do you have a spine diagnosis? What have you tried? What haven't you tried? And for us, we really, during the consultation, try to link all of these either together or apart. Linda from 819 and Michael from 518. Linda asks, spinal stenosis, C5, C6, arthritis, C1, C6. Michael says, neck stenosis treatment success rate. So again, neck stem cells for us, incredibly unique. Very few in the country that do this. But the consultation is going to be important. How much function do you have? How much function have you lost? Do you have nerve pains? Chodkowski from 303 said, can stem cell therapy help with a partial rotator cuff? Yes. So stem cells have been shown to fully heal partial tears. So that's a pretty amazing thing. But the question we want to know is how badly is it torn? What's your function like? John from 914 says, stem cell treatment as an alternative to shoulder replacement. Yes, we've had excellent results specifically for shoulders. Over the last 4 years, we have not had a failure, touch wood. Unique protocol that we follow that's probably a little different than what others may do, but we've certainly helped pickleball players, overhead activity players, tennis players, and really helped those who are just looking for even getting back to activities of daily living. Danny from 518 says seeking answers on arthritic hip pain and loss of mobility. So that's essentially what we're trying to target, Danny, is utilizing the stem cells to reduce pain. 7 to 10 years in some of these results without surgery, without medication. Success certainly depends on several factors. Consultation is key. Ed from 315, is stem cell therapy effective for severe arthritis in the shoulder bone on bone? So again, similar as the person from before, not had a failure in 4 years. Plenty of athletic individuals who've undergone this, and also for those who are just looking to live day to day without pain. John from 585 and Robert from 607. John asks, is the proven treatment covered by insurance? Robert asks, is if insurance covers any part of existing basics of how it works, how long before you experience any results? Unfortunately, not covered by insurance. So that's a pretty simple answer there. Number two, excellent results, and the number of studies is growing. But if you're wanting to understand how well this works, it really depends on the experience of both your physician and the practice that you're going to. It's essentially critical because the number of studies is growing, and it's not something that is readily available on every corner, on every block. It's something that really needs to be paid attention to in terms of both research and analysis of your doctor and the physician. Ultimately, the results on this will depend on what we're treating. Some results can be immediate, some can take a few weeks. Judith from 518 said the how and the whys. So for us, the three pillars of regenerative medicine, and you've heard me say it before, is getting an accurate diagnosis. Can we get the accurate material? And can we accurately place those materials? So those are some pretty key components. William from 917 about stem cell treatment for arthritis and sciatica in the low back. So arthritis of the spine can lead to crowding of the spinal nerves, right? So we talked a little bit about stenosis, and those nerves can be anywhere from L4 to S3. Those nerves, as you can see, as they come out, all merge to create the sciatic nerve. It's like a highway and four different on-ramps coming onto it to make one uniform highway. Each of those roads that are coming in basically feed in to that sciatic nerve. But the solution is relatively simple. Treat the arthritis, and then you're treating the sciatica. And we're talking about 7 to 10 years of resolution for some of these things. But of course, we always want the consultation to start. Donna, oh, this is a long one. 561 says, used to run 5 miles, 3 to 4 times per week, work out at gym, lifting weights, no longer running. My activities are limited. Both knees, right shoulder, September 24 x-ray show moderate tricompartmental osteoarthritis, both knees. In June, cortisone, knees, shoulder, reduced the pain significantly. Previous injection, 3 to 4 months. HA injections last November didn't help. February 23, x-ray show rotator cuff, tendinopathy, right shoulder. Ultrasound of shoulder, knees in October, November. Stem cell therapy, relief pain in my shoulder and knees longer than the cortisone shots. Can stem cell therapy fix my knees and shoulder, or is surgery still necessary? How many visits would be required for treating my knees and shoulders? Regarding my husband, Aaron, DDD, degenerative disc, cauda L3 to S1, 4 surgeries, 99 to '05, manages with morphine, crazy metabolism, requiring a higher dose than normal. Would stem cell therapy fix him? Or would this be more of a pain mitigation treatment? So to focus on you first, stem cells, knees, shoulder, absolutely. From the sounds of it, you would be a candidate. Obviously, we'd want to meet you in person, see the level of activity, but it sounds like you're into being an active person, so that's always a good sign. Degenerative disc, yes, very helpful. And again, talking about 7 to 10 years of relief from some of these diagnoses. But consultation for you both. Jason from 585, can a higher degree of mobility be restored in an 82-year-old woman with a history of TBI, so back and legs? So I guess the question for you, Jason, is the problem in the back and the legs, or is it the TBI that's led to that? So certainly differentiating that is going to be important, and I certainly recommend you to call to help us figure out which is which. Teresa from 315 said, discuss pain relief options for scoliosis. So this is a little different. So scoliosis is basically curvature, just like in the X-ray shown here. It's not particularly painful until it is. And for those with scoliosis, it means you can still develop degenerative disc, stenosis, arthritis, except now you have a curvature and all of these other painful conditions on top. So absolutely, if you're having pain, and you do have scoliosis, pretty good chance you have one of these diagnoses as well. And for us, it's treated exactly the same. Dolores from 518, Anna from 514. Dolores said, getting rid of leg pain. Anna said, would the stem cell cure my sciatica nerve pain for good and not return? So again, back and leg pain. So sometimes the leg pain is what we call a referred pain. It may not be the original source of the pain, but the nerves coming out, superhighway we talked about, may be the contributing factor. So it's really about where that wire or where that road begins. Can we find where that pinch exists? And if we can do something about that area of pinch, then we can talk about, 7 to 10 years of relief. And when you say for good and not return, I'd say semi-permanent. So cure really depends on, do you have permanent nerve damage or not? And do you know where the pain is coming from? Brian from that 607 said, already have an MRI, been diagnosed with spinal stenosis. Will stem cell therapy reverse or only slow progression? I have leg numbness, tingling, hip and knee pain, transient weakness with foot drop. So we're talking so specifically for you, Brian, what we're talking about is the reversal of the symptoms, not necessarily reversal of the picture, but reversal of the symptoms. And when we do this, we're talking about 7 to 10 years of relief and repeatable. The foot drop really needs to be reviewed in consultation. I need to see the foot drop. I need to see the severity of it, and of course, the timeline associated with it. Charlene from 518 says, actual process of harvesting stem cells and how they are injected into the vertebrae of the spine, recovery time, pain, discomfort to expect, lasting beneficial effects of stem cell therapy, and the success rate. So for us, stem cells are removed from the posterior of the pelvis in that spongy bone material. So if you could see on the right-hand picture where the back of the pelvis is and where we're actually extracting from, the bone looks like the left-hand side of the picture where you've got all those little pock marks. Our injections are always done under guidance. And I'd say after the therapy, you feel quote unquote normal within about a week, with, of course, a 7 to 10 year timeline for the results. Terry from 585 said, I have chronic back pain, had a hemilaminectomy at L4 in May of 24, have participated in physical therapy from August until 2 weeks ago. 600 milligrams of gabapentin plus 1,300 milligrams of Tylenol 3 times a day. I want my life back. I bet you do, Terry. We can help you get your life back. It sounds definitely like you've got a bit of post-surgical failed back syndrome. My primary goal in all of this is to get you off of the medications, get you more functional, and get you stronger. Certainly, somebody, in this scenario, somebody we have helped in many similar situations. Mia from 860 said, just more info, inquiring on behalf of my father. Hopefully, it's been a helpful webinar. More information can come from direct consultation. We've got older webinars up there. Pay attention to the frequently asked questions of every older webinar because I say the same thing in the beginning half every time. Gina from 518 says, if I can live pain-free for the first time in 20 odd years, answer we feel is yes. Longest period of pain ended in any patient that we've done was for 40 plus years. And then got them pain-free, obviously. We'd want to know what can you do, what can't you do, how far can you walk. Consultation will reveal all of that. Stephen for nerve regeneration in area code 802. So regeneration of nerve is a little bit complex. It's direct versus indirect regeneration. What we've really found as two very important factors is number one, if you've had the nerve damage for less than 5 years, very good sign. Number two, do you have a wax and wane component to your spine pain or to your nerve pain? Sometimes better, sometimes worse, sometimes not there, sometimes the worst possible pain ever. So that up and downness of the pain is an important factor, but also a good sign. John 315 says elimination of back pain and improve function. Oh yeah, sorry, improve motion. Basics are that we do direct, precise injections. We're using your cellular materials into the areas of disrepair and then obviously repairing that. Important first step is arriving at a diagnosis. So back pain is important, but what is the diagnosis that's giving you that back pain? Consultation. Roden S from 502, Jim F from 518. RS says simply knees. Jim F, therapies for hip pain. Answers yes. Next step, consultation. Mary for 518 said of sciatica, could this be something that will be helpful? So you saw in the pictures prior, it really depends on where the sciatica is coming from. So yes, we feel like we can help, but it depends on can we find where that is coming from. So sometimes understanding the sciatic nerve, sometimes understanding the diagnostics, is important, finding where that sciatic nerve is pinched. Greg from 315 says, is PRP Contessa indicated for people on blood thinners like aspirin and Eliquis? I'm not sure about Contessa, but with regards to PRP, yes. Depending on what we're treating, you can continue both your aspirin and your Eliquis, or we may ask for a brief hold, similar to sometimes when people go to, say, either a dentist or having another medical procedure done. We review your medications and make recommendations at that time. Mark from 518, results and knowledge of stem cell therapy for degenerative disc, costs associated. Hopefully, this webinar has been helpful. Understanding that costs can vary significantly. Consultation will be required for full assessment, but I promise at the end of that consultation, you'll have your costs for your particular therapy. John from 518, more information about the process. Hopefully, this webinar for you, John, has been helpful. But of course, at any point in time, our consultations are personal, they're in depth, they're unique to you, so can get you a heck of a lot more information above and beyond this. Debbie from 415 says, what makes you folks different and better? This is a good one. So I would probably say it's honestly experience. We've been doing this for over 10 years, done thousands of procedure. We are intensive specialists. We've done the most complex, we've done the most difficult patients. And you get to do that over 10 years and thousands of patients. The important thing too to understand, Debbie, is that this is all we do 100% of the time. Morning, noon, and night. This is what my office is geared for. If you take any trade or craft or therapy, you want your heart surgeon to be a heart surgeon, not a general surgeon. So it's that sort of idea. We also bring things that are specific for this. We have MRI with AI technologies that's geared for what we're doing. And we have a dedicated staff that only do this, of which my nurse has been with me for 9 of those 10 years. So you can understand we do a lot of this and we do this well. All right, finally to the end. So if you have questions, start to type them. But for anybody who's attended this webinar, happy to offer you a free consultation. Caveats are that you have to schedule by this upcoming Friday, so 2 days from now. Just please mention webinars and schedule that consultation. August 13th is our next webinar. If you're on the fence, need to hear this all over again. Phone numbers that are important, 518-871-9900 for local people, 514-697-8919 for people north of the border. Again, webpage is richardkimmedicine.com. If you want to see more webinars, just go to /webinars and then /MRI if you're interested in scheduling your own MRI to start the ball rolling during the consultation. And there are some questions. Let me see if I can. pull up these questions. Sorry here. John Strong said, will this work on bone shoulder with arthritis? The answer is yes. Treated many, many people with bone on bone shoulder arthritis. Our oldest was in his 90s, I want to say. Did well moving forward. Jim Corwin said, I've had 6 lumbar MRIs since 2018. Wow, that's a lot. Most recently, April of 25, after worsening symptoms, unchanged since then. Do I need a new MRI if I see you for consultation? Really depends, Jim. When is your consultation and when you decide to do therapy? So we really try to have a recent MRI as close to our time of therapy, but our therapies all include the MRI. So don't worry about getting a new one or worrying about trying to figure out getting a new one. The April one is great for getting a consultation now. That's going to give us a ton of information. I'd probably say if you're going to start relatively soon, won't need another new one. But if you're deciding months from now, we'll likely repeat the MRI. Diane Cuffle said, why is it that stem cell treatment is covered by Medicare for cancer treatment? Great question. So, stem cell therapy for cancer treatment is completely different. It is an in-hospital therapy that for people with leukemia and lymphoma is what it's designed for. During those therapies, it is very, very different. They ablate your marrow, which means they basically kill your bone marrow. Sorry, they harvest bone marrow, then kill your bone marrow, and then give you your bone marrow back. And so that by doing that, the whole idea is that you can then return your bloodlines and develop, a bloodline free of leukemia, lymphoma. The therapies in how they get decided for insurance coverage are not always under my control, but CMS has decided it this way. Anonymous said, does osteoporosis affect treatment? It does not. So, it's pretty straightforward. Plenty of people with osteoporosis, and you can imagine treating people with degenerative disc or there our patient populations are 60, 70, 80 and higher. Many, many with osteoporosis, but yeah, they do well. They do well. So more questions? Okay. So it sounds like that is the end of our Q&A session. If anybody else has more questions, certainly happy to chat during consultation and get you some answers. Otherwise, hope you all have a good evening. Thank you.